We would love to welcome you, Kate, to our Career Insight this week, Meet a Midwife. I'd love to introduce Kate Giles, Education and Workforce Development Lead for Maternity and Neonatal Services. So, Kate, we'd love to move across to you. I know we've got lots of students here from Kingsby Green, Royal Wootton Bassett and Wellington Academy, all ready to ask lots of questions. So if you'd love to introduce yourself, that would be brilliant, please.
Of course. So, my name is Kate, and I am the Workforce Development and Education Lead Midwife at the Great Western Hospital in Swindon for maternity and for neonates. So, I did not even think about being a midwife until I had my child. And then, when I had my child, was very lucky to enjoy that experience and thought I want that job. So, I retrained, but when I left school, I didn't have my maths. So it was a bit of a journey that I had to redo my maths, and then I had to do an access course because I was a mature student. And then alongside that, in order to apply to university, I needed to get some clinical skills, work experience type for my uni application alongside my academic skills. So I then started to volunteer on our postnatal ward for 3 hours a week. And then I managed to get myself a job on the bank as a healthcare support worker. I did that alongside doing my access course. So then when I applied to university, I was able to say, this is my clinical experience and knowledge, and this is my academic level. I then got a place on the midwifery degree programme at University West of England in Bristol, and I managed to pass that at first class honours. And the reason that I only say that is because you're coming from a student that I don't get given anything. I have to work really hard. I didn't pass my maths GCSE. So once you find what you want and once you love what you're learning, it's very different. So I passed that at a really good level. I then started to work in the trust as a Band 5 midwife. I rotated from our postnatal and antenatal ward to delivery suite. I then became a Band 6 midwife and then became a Band 7 delivery suite coordinator. So that was the team leader in delivery suite. And then I'm now a matron for education lead. So that's my little story, and that has taken me about 18 years. It's my second career. So yeah, open to questions. Go for it.
Wow, thank you. That's so interesting to know that you went in as a second career, actually, because we don't do the same career for the whole of our life anymore, do we? And it's great for people to be inspired that it's not too late.
Yep, I was 27 when I had my daughter, so probably 29, 30.
Wow, that's great to know. We're going to crack on with Evie. She's got a question.
Do you enjoy about your job?
What do I enjoy about my job? So every midwife has different passions. My passion, and everyone laughs when I say this, is I don't necessarily like babies. I love caring for women. My particular personal passion is looking after women in labour. And I knew that from the minute I was a first year student and my very first delivery suite placement. So my personal passion is caring for and empowering women in labour. That's me, but everyone has different. Some people have community midwifery. Some people have, they want to be lactation specialists, so breastfeeding specialists. There's so many different midwifery fields, but that's mine personally. And education.
Wow, I know. just from a personal point of view, what's your biggest tip for empowering women in labour?
My biggest tip, it's not necessarily words, it's touch and eye contact.
Oh, that's really interesting.
Yeah, just being with them and giving them confidence, communicating, educating, bonding, all that stuff.
Wow, fantastic. And Ellie?
Roughly how many deliveries do you do per day?
So I am non-clinical in my role now. The hospital will do about 4.5 births a year, 4,500 births a year. Typical midwife, do you know, I don't actually know. The hospital will do 10 to 15 in a 24-hour period, depending on whether it's crazy or a nice day. Let me just, does that help a little bit? When you're when you're a student, you have to count your births, and I'm really like, I wish I'd kept counting, but I stopped. So I don't know.
That's great, thank you.
So in regards to, like, obviously I know you didn't complete your training until you were much sort of more experienced, but when you did start, how did you get into the volunteering, the work experience stuff? Because personally I struggle to find work experience
Yeah,
in
so I'm
a
really,
clinical setting.
yeah, okay. So I'll answer your question first, and then if you want, I can go on into doing all the routes in for school leavers. Do you want me to do that?
Yeah, that'd be great, thank you.
Yeah, so it is very, very competitive to try and get into maternity services. So what I'm going to probably combine the answer actually. So at the moment, the routes in, they're changing. So the routes into, you can get, when you finish school, you can do A levels, or you can do a T level, or you can do a BTEC in health and social care. Now the T level, they will do their placement hours. If you choose midwifery in your second year, they will then come and do 315 placement hours, whether they want to be physiotherapists or nurses, mental health nurses, pediatric nurses, or midwives. You will go to that area and do your placement. Now, there's a really good opportunity then, if you choose a T level, that you will then be able to come into the unit, sell yourself, show how passionate you are, show how hardworking you are, and then you will have your name, your face, people will know you, and they can then guide you and say, right, when you're under 18, you can apply to have a bank contract in your placement area when you're a T level. So you could have a bank contract to come and work as a healthcare support worker in the maternity unit. Once you're over 18, you can have a bank contract to work in the whole hospital. So if you can get as a T level, you can just get your foot through that door and get those contacts to help you. If you do BTEC in social care, then you'd have to try and get yourself into the unit. And I suppose what you could do then is go and contact volunteering, or go on the bank contract. So there's a volunteer's email address or telephone number, or look out for employment open days. Then you could come and volunteer on in any of the areas for a few hours a week. That way you can get in and get to know what your, true frontline midwifery and whether that is for you, and also then get to know people on the floor to help you with application processes. Then what you can do once you've finished your college, so your next step, because I think I'm talking to school up to year 11, so you've done your college, you go and you do your A levels, or you do your BTEC, or you do your T levels. You can then decide whether if I'm going to go off and I'm going to do a direct entry degree in midwifery. Our nearest one is Bristol, but there's another one in Winchester, which is, to be honest, the same distance as Bristol. You can then go direct entry. Now you're going to need your maths and your English and your sciences at grade, sorry, I'm going to show my age. That people can tell you C and above. Is that 4, 5 and above, in order to get into those university programs? So that's one route. Or you can actually go away to university and do midwifery in Cardiff, anywhere, London, Nottingham, York. There's loads of universities do midwifery, and that's a 3-year full-time degree program. Or what's actually happening now, and this is the first year it's happened, so we've got our first cohort, is a midwifery degree apprenticeship. Now, the key is in the name. It's not a standard apprenticeship as we know, as people sort of older people my age would think of an apprenticeship, but it's a degree apprenticeship. Now, what you have to do in order to get on that is you have to get a job as a healthcare support worker in a maternity unit. How are you going to do that? You're going to do that if you're a T level and you see the jobs coming about, and then you can apply for them. We've got one T level that came to us on placement and wanted to do the apprenticeship. So she's come to work as a support worker. We've got other T levels that have left and gone off to do the direct entry full time. So they've gone off that route. Then the midwifery degree apprenticeship is full time, but it's a degree apprenticeship. So you do exactly the same learning as the direct entry degree, but when you're in the trust, you're paid as a band 3 whilst you do it, and that's 3 years. So this is very new initiative, and our very first cohort started in January 24. The challenge with that is that at the moment, the trusts, the hospitals aren't given any money to support, so they have to take the money out of their own budget. So trusts are reluctant to do it, and not all trusts are doing it. We're doing it, but with very small amount of numbers. Now, NHS England are talking about potentially backfilling that funding process, because then that will offer it to a lot more people. And I'm very aware that I've said a lot of information, so I'm going to be quiet just in case anybody wants to like get me to stretch out that answer a little bit.
No, that was great. Thank you so much.
Great. And I think Royal and Bassett Academy have got a question as well that might carry on from that, or might be in a different direction.
No, it's a slightly different question, actually. It's a question from Katie that I'll kind of paraphrase. You said you were a level 6 qualified midwife, but what are the different roles that you have to take on as a midwife? You said you specialise a bit in labour, but what are the different kind of roles that you might take on as a midwife?
So there's lots and lots of roles. So when you very first qualify, you are a band 5 midwife, and you are then employed as a rotation. So you work antenatal, postnatal and delivery suite. And then what we do is a preceptor. You're a preceptorship midwife, and that's about a year to 18 months, sometimes 2 years, but usually on average about 18 months. And that's where you get all your clinical competencies to be an established, confident midwife. Then you can choose whether you want to do different specialities. So you can then decide, I want to go and work in a high risk outpatient unit. I want to go and work in community. I want to be you could be a smoking cessation midwife. You can be a fetal surveillance midwife. You could be a delivery suite midwife. You could be a postnatal midwife. You could be a mental health specialist midwife. I could go on and on and on. There's loads of different specialist routes. You could go into education like I've gone into. You could leave the profession and go to university and teach. There are so many different routes once you've become a qualified midwife that you can take, or just stay as a rotational antenatal, postnatal, delivery suite midwife, which is what a lot of people do because they enjoy that clinical care aspect.
That's great. Thank you. Brilliant.
Wow, that's so interesting to realise there's so many different specialisms. Thank you for talking about that. So over to Flo, who was one of the main requests to have a meet and with midwife session. So here you go, Flo. This is your moment.
Talking about like qualifications post 16, what would you recommend? Which ones would you recommend to do?
So post 16, depending on how yourself, your personality, your abilities, your either direct entry degree or a T-level.
Thank you.
And that T-level, so I think you can choose the T-levels like in health and social care, and then it's 2 years, and then the second year you can choose your midwifery as a specialist. And that's, I don't know whether I don't know where you live, but there's like local higher education colleges that run them, but that's your best route in midwifery. You're going off to university, go and do your A-levels, do a T-level or do a T-level.
Great, thanks, Kate. Back over to Royal and Bassett.
Hi, thanks. My question is about like nursing in general versus midwifery. Do you find kind of people moving across between the two? Would you necessarily recommend going into like doing more of a general nursing qualification, or in terms of that kind of route in between nursing versus midwifery?
So they're actually two completely different specialisms, and people do not go backwards and forwards. So you can either qualify, you can do a nursing degree, or you can do a midwifery degree. I never wanted to be a nurse. I wanted to be a midwife, so I wasn't interested in going to do my nursing. If somebody wasn't sure what they wanted to do, you could do your nursing, and then you can do a 2-year midwifery master's conversion later on. But if you know that it's a midwife you want to be and not a nurse, then don't do your nursing, just do your midwifery.
Great, thanks. That's interesting that they are like kind of so distinct and so separate.
Yeah,
So,
it's completely separate degrees.
great, thank you.
With that in mind, Katie, or Kate, sorry, some of the T levels that are offered in our area, they're offering the T level in health, but not with the midwife specialism. So, and not kind of that line. So, if the pupil wasn't able to do the midwife version, would the T level in health still be okay because they could try and get a placement in that kind of area, or?
Yeah, so the T level in health. So we've got, so our two local colleges, a Cirencester College and a Swindon College, they both offer the midwifery as the second year specialist. So some people go and do the nursing, some people do midwifery. If your local colleges didn't, what would my thoughts be then? My thoughts would be talk to the college and find out why they're not offering midwifery, what are they offering, find out other colleges that are offering midwifery. If those colleges are too far away and you can't get to them, I would always choose a T level that you could, if you are determined to do your midwifery, choose a T level that you can do midwifery, because then you can come and do your midwifery placements in a midwifery unit. If you can't do that yet, then yeah, I would probably suggest doing your T level in your healthcare, or your A levels. It's the T level can kind of really give you that vocational experience and background for a nice juicy personal statement for a university application, and the T level is actually equivalent to 3 A levels. So it depends what the kind of person you are, whether you're academic or and you just want classroom based study, or whether you want to come out into the environment. And I suppose if you just had the nursing option, I would just stress to the college placement lead, please, 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 can we try and get me in the midwifery unit? And then just, yeah, do it that way.
That's great advice. Thank you. That's great. Evie?
What subjects do you think that are most important to become a midwife?
GCSE level?
Yeah.
So I would just say maths, English, sciences. You just need to get your core. You need to get your core, and your careers advisors or teachers, lecturers can guide you best on that. But in order to get onto your T level and to get into or A levels or B Tech or you need your core. So it's just a stepping stone. So then choose which other ones you know you're going to enjoy. But unfortunately, you do need your maths, your English and your science. If you don't get your maths first time, if there's some of you sat there going, I really want to be a midwife, but I don't feel like I'm going to get my math, you can always retake your math. And if you really do struggle at GCSE level, the midwifery degree apprenticeship does accept foundation skills level 2, but then you're going to have to do, then my advice for your route would be T level, but then you need your maths again, so you can't do your T level. What would my advice would be? If you haven't got your maths, you're going to retake it. Keep trying to retake your maths, or then get onto your stepping stone and try and get a vocational based BTEC. If you can, I don't even know if you can get onto BTECs without your maths. You might be able to get advised on that.
Yeah, we can, in our careers teams, we can definitely support with that.
Yeah.
So if you've got any more questions on that, let us know. Over to Wootton Bassett.
Katie was just wondering about A levels as well, and whether is there any specific A levels, and then post A level, what would you suggest? Apologies.
Yeah, no specific A levels, just one as you know you'll pass would be a good start. You know, the subjects that you know you like and you're good at the end of the day, what it is it's UCAS points on a university application. So if you decide to go down the direct entry route into a university to do a midwifery BSc degree, it's a UCAS application, and it doesn't matter what topics they are, they're just credits, and you need a certain amount of credits to get into a university degree program. Now, you also do need those credits to get onto the midwifery degree midwifery apprenticeship, and that's around the 120 credit marker. So it's just choose subjects that you know that you are strong at. The GCSE is different because you need those core, but the A levels are just credits.
Great, thank you.
What is the average salary for a midwife?
So you can Google this on your phones. So the average salary is a band 5, and it's the it's I think a starting salary of about 20 to 30. Then midwives, within a year, when you get your band 6, you'll go 30 to 40. Now that's a basic rate. Your senior midwives, you could be a band 7, which is 40 to 50, and then your band 8 matrons about 50 to 60. But you can Google it. If you Google NHS banding salaries, it's across the country. It's not trust specific. And then when you're that's your basic rate, but you've also got enhancements. So with midwifery and with nursing, it's 24 hours a day, 365 days of the year. So you will get your basic rate plus a time and a half for a night shift and a Saturday, and time and 2/3 for a Sunday. And that enhancement looks like anything between £300, £400, £500, £600 a month extra. So when you see shift worker midwives, I think a basic roughly take-home salary would be, for a full-time midwife, would be £2,000, maybe. Depends on what you work.
Thank you. Where could you work in this job?
So I think I've already answered that. So you can work in a community setting, which would be a combination of working in a hub and then going out to houses. You could work in a hospital setting, which is like antenatal, postnatal, delivery suite, birth centre. You can become in a non-clinical role, go into education, work at colleges, universities, or you could work at specialist roles. So I'm based in the hospital. And all of the specialist midwifery roles are based at the hospital.
Great, thank you for clarifying that. Ellie, got a question?
How many days off do you get in a year, like on average?
So we work so I'm non-clinical, so I don't, but clinical midwives work long shifts. So you work a 12-hour shift. You actually work a 12-hour, 45-minute shift. So you'll work from 07:30 to 20:15, or 19:30 to 08:15, but you only actually do 3 of those a week. So you have 4 days off a week. And you'll do a combination of day shift, night shifts, but often what you'll do is you'll do a cluster of days, cluster of nights. They're not mixed because that's not sustainable. So you'll be a full-time midwife will be 30. You can do 37.5 hours, which is a standard full-time, but most people do 36 hours because we do the 12-hour shifts. So about 4. So you'll then get 4 days off a week, which I still miss 3 years on from my clinical role, now being in the hospital 5 days a week.
That's a lot more than I was expecting. That's quite good.
Yeah, I mean, your shifts are long. They're really long because they're like nearly 13 hours, but having 4 days off a week is incredible. And if you think that you worked, if you worked Monday, Tuesday, Wednesday 1 week, but Friday, Saturday, Sunday the other, you're off Thursday, Friday, Saturday, Sunday, Monday, Tuesday, and you got all that time off.
Wow, that's amazing. Thank you.
Yeah, and then also if you think that we get really good annual leave. So actually you can actually have all those days, and then you could put in 2 days annual leave, and then you could have like 2 weeks off. It is crazy.
Thank you. Royal Ambassador.
Hi, Katie had another question regarding grief, and around any stillborns, and how you deal, or how the training is around that.
Yeah, so that's the not true frontline midwifery, brings a lot of challenges, and we're faced with that quite often. They're newly qualified midwives are never put into that situation, that clinical situation. We have what we call a personal midwifery advocate, where that offers pastoral counselling support. We've got a bereavement team, specialist midwives. We've got like counsellor trained midwives. After any specific incident, we have immediate debriefs. We also have patient safety review meetings where we meet in a multidisciplinary team so we can all talk about the situation and what involvement we've had. I can't take away that it's not a challenge, because it is, and all of us have been through cases that we take with us, take a long time to process, and will always hold dear to our hearts. And as I've progressed and become more experienced with that, and more, I suppose also more, not more mature, more experienced, is that somebody can go through a really challenging situation, but that challenging situation was going to happen anyway. You ended up being the person involved, but you can still be really, really powerful and really, really impactful, and remember and treat in a positive way. So that negative experience is still, like, that person will remember you forever. And that's happened to me with specific scenarios, and that's helped me get through those cases and those situations, to know that I just thought it was bad, but actually seeing those people further on down the line, it's not, because you've been so incredibly empowering and supportive in that role. Am I making sense?
Yeah, absolutely. Thank you. Thank you.
I have a quick one. So I'm currently doing my A-levels, and the goal eventually at the end is to study medicine, but obviously whether I get the grades for that or not, I'm not really sure. But obviously to study midwifery as a backup, is there an option or routes into higher levels of study afterwards, after you completed the midwifery?
Yeah.
I'm not sure if that's something you're sure of, or...
Yeah, there is. So once you've done your degree, again, there's levels. So midwifery is a level 6 degree. So you'll go in level 5, level 6, and then there's level 7 studies. So at the moment, I'm in the middle of doing my master's. Other midwives have done their master's, and you can choose what you. Some people don't want to do that level 7 study, but some people that want to progress in their career, they can. And again, that can be in all different aspects. So that could be in research, it could be in leadership, it could be in management, it could be in mental health. There's all different scopes of level 7 learning. You can then, so once you climb up the ladder in a trust, so you can become your band 7, then your band 8 matron, then the next step on from that would be a head of midwifery or a director of midwifery. Or you could step out of trust level and you could go and work for NHS England. You could work for NHS England local, NHS England national. There's a lot of scope if you want it.
Oh, that's brilliant. Thank you so much.
Super. Well, we're just coming to an end, so I'm just going to pass you over to Flo, who this request came from. I think she's got a big thank you, possibly maybe a last question, I'm not sure. So here's Flo.
Thank you so much for doing this. I've been wanting to do midwifery for years, so being able to have some information on it is really good. So thank you.
Not a problem. I'm all about encouraging people into I should say the NHS rather than just midwifery, but yeah, we need you all.
Brilliant. Thank you so much, Kate.